Hey, it's Dr. Charschan. I want to teach you a new exercise that I've just started using. It's called deer in headlights. The reason I'm teaching this one is because it's a little bit different than most of the exercises that I usually teach for people. Most exercises are about strengthening, sometimes retraining an area. This one retrains an area a little bit differently because what happens with people is that we all adapt. And our patients know this because I've said this like a zillion times, but we don't always adapt well, and we don't always adapt the same. So the idea that we're all the same is something we commonly see in healthcare. Everybody has a shoulder, everybody has a hip, but we're all built differently. We're all different sexes. We're all different in many, many ways. We've all adapted. We all learned to walk a little bit differently. We all learned to run a little bit differently. So we have all these adaptations. And one of the adaptations that most people forget about is the idea of neuroplasticity. You can look on our blog on backfix01.com and look up neuroplasticity. There's an excellent video of a professor that's demonstrating the idea of neuroplasticity and why it's important. When we're children, when we're babies, neuroplasticity is instantaneous. Newborns are constantly learning things very, very quickly. In an adult, it takes a lot longer. One of the things that we do learn is we learn patterns. So the brain learns patterns. A lot of times, if we've adapted improperly, even through the fascial system, which controls a lot of our muscular movement, has its own blood supply, has its own nerve supply, it's very difficult to really fully understand the neurological pathways that adapt this, because that adaptation has to do with the way that we create pathways in the brain. So this exercise is unique in that what it does is it actually teaches you how to go ahead and get your brain to find your glutes, and then to train the core and then build on that. And I learned this through recently certifying or getting certified as TPI1 on the Titleist program. And one of the exercises that I learned was this idea of getting the brain to find the glutes. So in this exercise, I'm going to teach you how to do that and build upon that for better core strength, better core stability. And in many of our patients, it's solving a lot of chronic problems. So I'm going to show you how to do the exercise, and I've enhanced what I've learned in TPI with some other things to learn advanced control of the pelvis. It takes some work, it takes some diligence, but I think you're going to find this one is extremely important and extremely helpful and effective. The first part of the exercise is I'm going to have you take your palms, palm up, and we're going to put it underneath our glutes, our butt. But unlike how I was taught, I also want you to put your thumb, and you'll notice I'm putting my thumb along the side of the back, or the hip. And the reason I'm doing this is because when we're trying to isolate this, I want to be able to make sure I'm not bringing in other elements that my brain maybe is telling me that this is a normal part of doing this. So a lot of people, when I tell them to find their glutes, they have a lot of difficulty with it and they can't understand why. So the point of the exercise is to train you and train your brain to find your glutes. And as a result of that, we can now isolate things, and maybe it'll translate into your gait, which will improve the way you walk and the way you feel. So the first thing I ask people to do is I ask them to try and isolate. So I'm going to ask you to first tighten up your left glute. And I can do this because I've been working on this a while, and relax. And I'm feeling to make sure that I'm not tightening up my leg, tightening up my hip, tightening up my back. Then I do the other side. And then I relax. Then I do the other side again. And I'll ping pong back and forth so I can control this. I do it every single morning until I'm really getting the hang of it and feel like I can do this. Then I'll tighten up both. And then I'm going to relax. And then I'll try the left again. Then I'll try the right again. And I even find myself, sometimes I'm bringing in other elements. I'm really trying to isolate. Then the second part of it is, then what I'm going to do is something called the glute bridge. So I'm going to tighten up the glutes again. And I'm actually, if I'm doing this correctly, and I'm isolating it very well, and I can feel that I have a little bit of difficulty doing this, next thing I want to do is tighten them up enough So I'm feeling the glutes lift a little bit. So the pubic bone is starting to head to the ceiling. In other words, I'm rocking the pelvis forward only by using the glutes. And I'm going to hold this for 10 seconds. And then I'm going to relax. Then I'm going to try the glute bridge on the left. So I'm going to just tighten the left side, tighten it up enough where I'm just tightening the glute and I'm feeling it lift off the table just a little bit. Holding 10 seconds. And I'm going to do the other side. The next part of this is being able to add control of the pelvic bowl, which is deep inside here. So I'm not using my abs, I'm not using my legs, I'm just using this. And the whole idea is I want to be able to rock the pelvis backwards so the pubic bone heads to the ceiling. So my hands are here and I'm going to tighten up the glutes so I can tighten them up already. Now I'm using the pelvic bowl. As I'm doing this, I'm feeling my back flatten against the table, which is what I want. And I'm going to do that bridge for 10 seconds and relax. And then I'm going to do it again. So you're doing this sequentially. If you're having problems getting the first two done, just do those. Just do the glute bridge. Then we'll add this in. And once I start to feel like I can control this, and I'm not using my abs because if I was, I'd be pulling up this way. All right? And I'm not using my legs because my fingers can feel that the legs aren't being engaged. The next stage is to take it one step further, where we're going to stand against the wall. And I'm going to flatten my back against the wall, but I'm only doing it by tightening the glutes and the pelvic bowl. And as you can see, the pelvis is pulling forward. So I'm tightening the glutes, I'm tightening pelvic bowl, and I'm controlling this. And I'm relaxing the legs, I'm relaxing the abs, I'm relaxing everything, I'm even relaxing the lower body. Once I get the hang of this, now what I'm going to do is I'm going to stand away from the wall, and I can do this in front of a mirror. And what I want to do is I want to control this backwards and forwards. So I literally want to be able to tip the pelvis backwards, tip this forward. As Titleist puts it, it's almost like a bucket, tilting it forward, tilting it back. So I am controlling this purely by these muscles in the pelvic bowl, nothing else. Most people that have challenges doing this, and a lot of the chronicity we see in the office is really linked into this. Then what I want to do is I want to be able to control it. Can I go ahead and shift it to the right? Can I shift it to the left? And I'm doing this, and I'm doing this just with the pelvic bowl, nothing else. And then I want to be able to shear. Can I shear up? Can I shear back? So I'm literally teaching my brain all these different motions which should happen normally. Now in the game of golf, you need to disassociate certain things. In certain other sports, you know, if you're somebody who does speed skating or you're dancing on the ice, or if you're somebody who is diving, disassociation and learning these skills is very, very important. Even a baseball swing, even the golf swing, they make a big point about that. So that disassociation is actually part of how we keep the back healthier. I know this is not standard things that you would typically learn, but the truth is if you want the back to function better, sometimes we have to teach the brain how to go ahead and make it work. And sometimes we forget about that the brain is actually part of how we function because, listen, there's fascia, there's muscles, there's circulatory system, there are all these different things, but the brain is really what runs a lot of it. And if we don't get the brain to memorize the patterns properly, improper patterns can cause chronic pain.